Over the last 24 hours, we have identified 505 new cases of COVID-19 and completed about 10,900 tests. Our positivity rate currently stands at 4.8%. We have identified 91 new cases of the variant of concern, which represent about 12% of our active cases. Looking to schools, there are currently active alerts or outbreaks in 297 schools, or about 12% of the schools in the province. Currently, these schools have a combined total of 1,241 cases since January 11th. There are currently 264 people in hospital with COVID-19, including 43 in the ICU. Sadly, one new death was reported to Alberta Health in the last 24 hours. I am pleased to inform you that starting tomorrow morning at 8:00 a.m., AHS will open booking to all remaining birth years in Phase 2A. The booking tool will be offline for 30 minutes from 7:30 to 8:00 a.m. to prepare. And after that, again, all eligible Albertans in Phase 2A can make appointments. As well, participating pharmacies continue to book appointments for everyone born in 1956 or earlier. I would also like to remind Albertans that once you are eligible, you stay eligible. So whether you became eligible last week or last month, you can continue to book your appointment if you have not already done so, as we proceed through our rollout. One of the things that, again, is really important to consider, and one of the things that we've heard from many, many Albertans, is how much the absence of social interaction, in-person social interaction, has impacted them. And as we have always done, we've been looking at the impacts of COVID-19 and the impacts of restrictions. So I think one of the things that is currently important to consider is if there was a framework that minimized the number of people or minimized the risk to allow again, that risk mitigated type of interaction to happen, whether that would actually be better than the current state, because in some ways perhaps the current state is causing people to feel that they just can't follow the rules anymore, that the pressure of isolation is becoming too much. And so again, we have to make sure that we're not thinking about the rules as an abstract thing that will always be followed, but rather as something that we want to work with Albertans to try to reduce the risk. And if small kinds of social gatherings will help to mitigate that risk of isolation, but also minimize the chance that people may be having very large social gatherings, then that may be a pragmatic step to take. Again, no decisions have been made, but it's really important, again, that we consider the real-life implications of the rules and continue to encourage Albertans as much as possible to minimize in-person interactions indoors with people outside your household. What we're seeing is an overall increase in cases and slight overall increases week to week in the proportion of all of our cases that are caused by variants of concern. And so again, I am concerned about this trend. We are seeing, as I mentioned in my speaking notes, some particular areas of the province that are having a particular growth, but we know from earlier experiences that that can spread to other areas of the province if we don't collectively make decisions to reverse that trend. So the rise in variants, the rise in cases, both of those are concerning, and we do need to continue to watch those and use that information to help all of us make decisions about what we do every day. The coming weeks will really tell us that story, and we certainly are seeing some concerning early trends. I would say that a couple of weeks ago, we saw week-over-week rises in our new cases, followed by a stabilization. And so right now, again, we're in a very, very critical time, and our collective actions now will determine what we see in the weeks ahead. So whether or not our cases continue to rise in the coming weeks, again, that really is up to all of us. And we will know, I think, in the coming weeks, again, what the current interactions Albertans are having with each other, what impact that has on transmission. To be clear, if people are choosing to interact with others outside their household right now, that is against the rules, and it is putting others at risk. However, if we go forward with a slight easing of those rules, it may help those who previously were having large gatherings perhaps to reconsider and scale those back. So again, it's about trying to do our best as we're considering what framework to put in place to meet Albertans with the path that we are most likely to collectively be successful at. But whether or not this is something that is put in place as a framework, I would continue to advise Albertans, especially if we see variant cases continue to rise, to think twice before having a gathering with someone outside your household. And again, if people are feeling isolated, as I know many, many are, consider having that gathering outdoors where, even though the risk isn't zero, it is greatly reduced. So I recognize that it's not black and white, but that's because the reality is, again, that people need to make decisions in complex environments, and we're trying to set the rules in a way that helps most people be able to follow them most of the time to reduce our overall risk of transmission.